14 signs your liver may be failing. Unusual indicators to watch for after 50. The liver is one of the most vital organs in the body, responsible for over 500 functions, including detoxifying the blood, producing bile, and aiding in digestion. However, liver disease can develop silently, with subtle signs that may be easily overlooked, especially as we age. Individuals over 50 are at greater risk due to years of accumulated exposure to toxins, medications, alcohol, and potential underlying conditions like fatty liver disease or hepatitis. Below are 14 signs that could indicate your liver is struggling. If you notice any of these symptoms, it's important to consult a healthcare provider promptly. 1. Fatigue and weakness. One of the earliest and most common signs of liver damage is persistent fatigue. The liver plays a role in metabolizing energy. When it's impaired, the body struggles to process nutrients effectively, leaving you feeling drained even after adequate rest. 2. Jaundice, yellowing of the skin or eyes. Jaundice occurs when bilirubin, a yellow substance formed during the breakdown of red blood cells, accumulates in the blood because the liver is unable to process it properly. This is a clear indication of liver dysfunction and should never be ignored. 3. Dark urine and pale stools. Changes in urine and stool color may signal liver issues. Dark urine can result from high levels of bilirubin, while pale stools often indicate a lack of bile, which is produced in the liver to aid digestion. 4. Unexplained itching. Chronic itching can result from bile salts building up under the skin due to reduced liver function. This symptom is often overlooked but can be a clue to deeper issues. 5. Swelling in the abdomen, ascites. Liver damage can lead to fluid buildup in the abdominal cavity, a condition known as ascites. This is often accompanied by bloating and discomfort and can indicate advanced liver disease or cirrhosis. 6. Spider-like blood vessels on the skin. Spider angiomas, clusters of blood vessels that appear as web-like red marks on the skin, can result from hormonal imbalances caused by liver dysfunction. They are often seen on the face, chest, and arms. 7. Nausea and vomiting. When the liver cannot process toxins effectively, it can cause gastrointestinal symptoms such as nausea, vomiting, or even loss of appetite. These symptoms are common but concerning if persistent. 8. Swollen legs and ankles. Edema, or swelling in the lower extremities, is a sign of fluid retention caused by reduced liver function. It is often painless but can worsen over time if left untreated. 9. Bruising or bleeding easily. The liver produces proteins necessary for blood clotting. When it's not functioning properly, you may notice you bruise or bleed more easily than before. 10. Weight loss without trying. Unintentional weight loss is a serious red flag, especially when combined with other symptoms of liver disease. It can result from a loss of appetite or metabolic changes caused by a failing liver. 11. Mental confusion or memory problems, hepatic encephalopathy. The liver's inability to remove toxins from the blood can lead to cognitive issues such as confusion, forgetfulness, and difficulty concentrating. This condition, known as hepatic encephalopathy, can become severe if untreated. 12. Chronic bad breath. A lesser-known symptom, Chronic bad breath with a musty or sweet odor could be a sign of liver dysfunction. This condition, known as fetor hepaticus, occurs when toxins build up in the blood. 13. Persistent bloating. While bloating can result from many conditions, persistent abdominal swelling could indicate fluid retention or liver inflammation, both of which require medical evaluation. 14. Changes in skin texture or color. The skin may appear dull, discolored, or even bronze due to liver damage. Additionally, some individuals develop small white spots or patches on their skin due to fat deposits. Risk factors for liver disease after 50. As you age, the cumulative effects of lifestyle, diet, and environmental exposure can increase your risk of liver disease. Factors to be mindful of include: 1. Alcohol consumption. Chronic use can lead to cirrhosis. 2. Medications. Prolonged use of certain drugs like acetaminophen can damage the liver. 3. Non-alcoholic fatty liver disease, NAFLD, common in individuals with obesity or diabetes. 4. Viral hepatitis. Hepatitis B and C can remain undetected for years. 5. Exposure to toxins. Long-term exposure to industrial chemicals or pollutants. Prevention and early intervention. While liver disease can be serious, it is often preventable or manageable with early intervention. Here are some tips to support liver health. 1. Adopt a liver-friendly diet. Focus on fruits, vegetables, lean proteins, and whole grains while avoiding processed foods and excessive sugar. 2. Limit alcohol consumption. Drink in moderation or avoid alcohol altogether. 3. Stay active. Regular exercise can reduce fat in the liver and improve overall health. 4. Get regular screenings, especially if you have risk factors like diabetes, obesity, or a family history of liver disease. 5. Vaccinate. Protect yourself against hepatitis A and B. 6. Avoid unnecessary medications or supplements. Always consult a doctor before starting new medications or supplements that could affect the liver. When to seek medical attention. If you notice any of the signs listed above, don't delay seeking medical attention. Liver disease can progress quickly if untreated, but early diagnosis can significantly improve outcomes. Medical disclaimer. This article is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your healthcare provider with any questions you may have regarding a medical condition or symptoms. If you suspect a medical emergency, seek immediate care. By recognizing these signs and taking proactive steps, you can protect your liver health and ensure better overall well-being as you age.